Hello, everyone. My name is Michelle Martin, and I'm a clinical pharmacist at the University of Illinois at Chicago. I work at the University of Illinois Hospital and Health Sciences System Liver Clinic. I have been working with hepatitis C patients since 2009. So I'm excited to talk to you today about the challenge of obtaining hepatitis C virus medication approval. My objectives for today are to discuss hepatitis C virus treatment goals and costs, as well as review some sample Medicaid and Medicaid managed care requirements for hepatitis C virus medication coverage, and also we'll list some patient assistance programs that can assist you. First, I wanted to do a little bit of background on hepatitis C virus, just to bring everyone up to speed. Hepatitis C virus is the most common bloodborne infection in the United States. It's nearly 4 to 5 times as prevalent as HIV is. And hepatitis C virus is the leading known cause for liver transplantation. It's also the main cause of liver-related death, end-stage liver disease, as well as hepatocellular carcinoma. There are many different hepatitis C virus genotypes, actually 6 of them that have treatment recommendations, and there are many different subtypes denoted by small letter A, B, etc. There's actually no current vaccine available. They are certainly working on this, but we don't have a vaccine for hepatitis C virus at this point in time. But we do have effective treatment. As you can see by the table here, we have many patients in the world that are affected by hepatitis C virus. It's estimated that about 177 million people have hepatitis C virus worldwide. And the global death rate is estimated at nearly 400,000 people per year. In the United States, it's estimated that we have between 2.5 and 4.7 million patients with hepatitis C virus. And of course, the death rate in the United States is actually climbing. So we have nearly 20,000 patients that die each year from hepatitis C. So it's our goal to treat more people to help cure their hepatitis C and prevent these morbidity and mortalities that we see with hepatitis C virus. So what is the goal of our hepatitis C virus treatment? We want to achieve a cure. A cure is denoted by a sustained virologic response, or SVR, and this SVR means that no virus was detected in the blood at 12 weeks after the completion of hepatitis C virus treatment. So it's important to get your blood checked during treatment and at the end of treatment, as well as 12 weeks after treatment, to maintain that we have a cure. Just to highlight that the goal for hepatitis C virus is shared by providers, patients, and insurers. We all want to make sure that we cure the patients who are treated for hepatitis C virus. So let's talk a little bit about the progression of hepatitis C virus. Here we note that on the bottom of the screen we have the approximate time in years, although this progression of hepatitis C virus differs among patients and the time of their infection and other cofactors. So starting off with acute infection, some patients will display symptoms or signs of acute infection, including jaundice, malaise, some nausea, and just general symptoms that may be dismissed. About 1 in 6 to 1 in 4 people actually can spontaneously clear the virus and not develop chronic hepatitis C virus. However, the majority of people actually do go on to develop chronic infection. They can then go on to develop mild, moderate, or severe hepatitis. And of those patients, about 1 in 5 will go on to develop cirrhosis, or the most advanced scarring of liver. From there, some of those patients will decompensate, meaning that their liver will no longer be able to do its job well. And from there, we move on to end-stage liver disease and the need for transplantation. Other patients with cirrhosis will go on to develop hepatocellular carcinoma. So that's why it's so important that we treat hepatitis C virus, ideally before patients develop cirrhosis, so that we can prevent these other things from occurring. We also want to make sure that we're screening our patients with advanced fibrosis and cirrhosis to make sure that they're not developing hepatocellular carcinoma. So now we'll move into the hepatitis C virus treatment evolution. On the y-axis, along the left-hand side, you can see the cure rate, or the SVR rate, that's associated with specific regimens for hepatitis C treatment. Along the x-axis, or the bottom, you can see the different treatment regimens and when they were first used, and then you can see what their level of cure, or cure rate, was. You can see that back in the 1990s, that the cure rate was very low with treatment. Treatment had a lot of side effects, and a lot of patients did not enjoy the course of treatment because it was much more difficult with a lot of side effects that they... This slide goes over the hepatitis C virus treatment evolution. On the y-axis, you can see the SVR rate, or the cure rate. Along the x-axis, or the bottom, you can see the different medications and when they were approved for use for hepatitis C virus treatment. You can see since the 1990s, the cure rate has improved drastically for the medications that we had. In 2011, we had our first direct-acting antiviral agents approved that were added on to treatment with pegylated interferon and ribavirin. These earlier treatments for hepatitis C virus had a lot of side effects, and patients had usually a lot of complaints during the course of treatment. Starting in 2013, we had the approval of all oral treatment for hepatitis C virus. So as you can see, we've had several different medications approved, and now we have 8 different regimens for patients who have genotype 1. So there are a lot of different options as far as the medications that we can use. And as you can see by the SVR rates, these agents are highly effective. So patients enjoy fewer side effects, and most patients achieve a cure. The problem, of course, is how do we pay for that cure? So there are a few different ways that we could pay for hepatitis C virus treatment. Of course, the first would be paying cash for the treatment. I have had very few patients that have actually been able to do this due to the high cost of treatment. The most common way to pay for hepatitis C virus is through insurance. And certainly we do have some patient assistance programs that can help either with copayments or to cover the entire cost of the medications in some specific instances. So this slide just goes over the wholesale acquisition cost, or the advertised price of the medications for hepatitis C virus. I bet you're all thinking, wow, these medications are super expensive. And it is true. That's why hepatitis C virus treatment has been such a challenge for most people to get medication approved through their insurances. So you can see on the top listing on the left-hand side, we see all the different medications that are available. And you can see in the middle column, we have the cost for 8 weeks because we have 2 regimens that are actually available for 8-week treatment arms. In the middle column, we have the cost for 12 weeks, and most agents are able to be used for 12 weeks. It's much less common now that we would need to treat a patient for 24 weeks. As you can see, those medications and regimens are much more expensive when they're doubled or tripled in length for cost. So how do we weigh these costs? Of course, the cost of genotype 1 treatment can be as little as $26,400 as that wholesale acquisition cost, up to $94,500 for the wholesale acquisition cost of a combination regimen, versus the cost of a liver transplantation. If a patient is unable to get treatment and then has progression of their liver disease, such so that they would actually decompensate and need a liver transplantation, the cost is extremely high. So it makes sense to treat people early so that they don't decompensate and need a liver transplant. I think it's important to go over the insurance basics for the second way of people paying for hepatitis C virus treatment. So I'm not an expert. I do not work for an insurance company, but just to review how insurance works in general. The first step is that people pay insurance premiums. Everyone pays a set amount based on their risk and what the insurance is requesting. The second step is that the insurance will pool these premiums together. And then the third step is that they'll pay out these premiums to patients for their claims. So they will reimburse them for the medications that they're requesting coverage for. And as you can see, these claims can vary drastically with their cost. So someone's claim for hepatitis C virus treatment can range from $10,000 to $30,000 per month, whereas someone's blood pressure medication might only be a few dollars per month, whereas chemotherapy is much more expensive than blood pressure medication, and depending upon what type of therapy, perhaps less expensive than hepatitis C virus treatment. So now we just have to worry about the insurance having enough money to cover all of the claims that are requested by the people that they insure. So why do insurance companies restrict hepatitis C virus treatment coverage? The most common reason is just that hepatitis C virus is expensive. And because insurance has limited resources and limited funding, that pool of money, that middle green circle that we saw in the last slide, is a limited amount of resources. And they have to make sure that they can cover medication for all the people that they insure. So the restrictions actually spread out the hepatitis C virus treatment spending over time. And the amount of money that's spent on the hepatitis C course of treatment, of course, is much higher than what they would spend on a blood pressure medication. So they could pay for thousands of people to get blood pressure medication with only one course of hepatitis C treatment costs. So that's a little bit on why the coverage is restricted through insurance. In our state, and this certainly will differ based on different states, but here are some of the specific requirements that our state's Medicaid and Medicaid managed care insurers issue for hepatitis C virus treatment. We'll start on the left-hand column as far as the documentation of sobriety. In Illinois, there is a sobriety requirement. So some plans require 6 or 12 months of sobriety, and a lot of plans actually require evidence of sobriety documented in a physician note or an alcohol or a toxicology screen within the last 15 days of submitting a prior authorization to try to get hepatitis C virus coverage. The second column from the left lists the documentation of treatment adherence and counseling. In our state, we have to have patients sign letters stating that they will be adherent to the treatment and that they will take the hepatitis C virus medication, follow up with the provider, get all of their labs on time, and complete everything as directed. And this is something that the insurance wants to make sure that the patient is actually willing to take the medicine that they will pay for. In the middle column, you can see the fibrosis score covered. And we didn't really talk about this yet, but F4 is cirrhosis and F0 is no scarring in the liver. So as you can see, a lot of people cover only patients who have F4 or F3, so either advanced fibrosis or cirrhosis. So the problem with this is that patients have already started to progress in their disease before they are actually able to get hepatitis C virus treatment. As providers, we would like to treat everyone before they progress to having advanced fibrosis or cirrhosis. The second column from the right is when the most recent hepatitis C virus RNA or hepatitis C virus level was drawn at the lab. And most people request that within the last 3 to 6 months. Some insurers also have other additional lab testing that they request. For example, an HIV screen or hepatitis B serologies, which actually should be done for all patients who are starting hepatitis C treatment. Some insurers request that we also obtain some resistance panels for the use of specific medications for hepatitis C virus. And this can vary based on the insurer's formulary. So what can you do to help make sure that you can get insurance coverage for hepatitis C virus medication? Well, the first would be advocating on your own behalf. If you are lucky enough to be able to select a different insurance or are in the process of changing insurance plans, contact your potential insurance plan to find out what the requirements are before you select them as an insurer if you need hepatitis C virus treatment. Unfortunately, this isn't always the case, and we're not always able to switch our insurance at a specific time during, the year. If you already have insurance in place, you can talk to your provider, so your doctor, your nurse practitioner, physician assistant, your pharmacist, and discuss the requirements of treatment with them. If you agree to take the medication, likely in some states you'll be asked to sign a letter of adherence if you have a Medicaid or a Medicaid managed care plan, and take the medication as it's directed. We want the patient to be able to obtain a cure just as much as you do, as much as your insurer does as well. If insurance requires sobriety, work with your healthcare provider to get some assistance and also get healthy. Also, get all the required blood draws when they're requested from your provider. And go to lab before the treatment, during the treatment, and after treatment as they're ordered by your provider. Some insurance plans will not pay for refills if you do not go to lab during set time points during the course of treatment. This is something that is certainly restricting several patients from continuing the treatment, and that's not something that we want as providers or patients. So our goal is, of course, to get everything approved for our patients. But what if your insurance denies coverage? So hopefully your provider, so your doctor, nurse practitioner, physician assistant, or pharmacist will likely appeal that denial. Some insurance companies require you to sign that letter to allow your provider to actually appeal on your behalf. And this is called an appointment of representation form. So specific insurers will require that signature from you and your provider. It depends on your plan. Some insurers also require a letter of medical necessity from your provider to state why you need the treatment and that you do need the treatment. And some insurances actually have strict formularies and they only cover specific medications. So it could be a denial just because the provider had requested a medication that is not covered by that insurance plan. So in some cases, your provider actually may request a different medication only if you're actually eligible to take that medication or if that medication is appropriate for you. And if you're not eligible for that specific medication that your insurance is mandating that you use, your provider will then likely need to write a letter of medical necessity to appeal and request a different medication that is a better fit for you. So our hope is that patients don't get denied, but more often than not, it seems like many of our patients are denied coverage initially. So then we have to make sure that we're undergoing the proper channels to get the medication approved. So what if your insurance still denies coverage? I always encourage patients to advocate on their own behalf by calling their insurance company, speaking with a supervisor, and expressing that they want hepatitis C virus treatment. I think a lot of insurance plans need to have that feedback from patients, that the patients are dissatisfied as well as the providers being dissatisfied with their decisions. If it is an option to change insurance plans to an insurer that actually will cover patients with your stage of disease, of course, this is not an option for everyone at specific times throughout the year. Also, you can join advocacy groups. There's a website, thestateofhepc.org, and that will give more details about your specific state. It gives state ratings and also some insurer details. So it will go over what some of the specific insurance plans will cover or will not cover for hepatitis C virus treatment. But what if your insurance approves the medication, but you can't afford the copayment? At our institution, we have several people who have high copays of $3,000 to $4,000 per month, which is unaffordable for most people. The HealthWell Foundation, as well as the PAN Foundation, can offer assistance to help cover these high copayments. So the HealthWell Foundation can go up to $30,000 for coverage, and the PAN Foundation has initial grants up to $7,000. For both of these foundations, it's important that patients meet the criteria. So patients must have insurance that covers part of the medication costs. They also must have an income of less than or equal to 500% of the federal poverty level. And they also must reside in and receive treatment in the United States. The websites are listed here on this slide for your information as well. So what if insurance is not an option? There are manufacturer patient assistance programs. Some of them, however, will not assist if your insurance denies coverage. Some will assist if you do not have insurance, though. So it's always worth asking. And also some offer copayment assistance. So they bring the cost of medication down to sometimes $5 if a patient has a higher copayment through their insurance. Their contact information is on the following slide. So here are the variety of different patient assistance programs based on the manufacturers that make the medication to assist with hepatitis C virus treatment. The websites are listed here, as well as the phone contact information, so you can certainly contact these companies and visit their websites to see what the specific requirements are. So as far as hepatitis C virus guidance, these are the recommendations for testing, management, and treating hepatitis C virus. It's available online. It's a website that will list all the different options for treatment for a patient based on their specific patient characteristics and treatment history and degree of fibrosis. Here's a list of abbreviations used throughout the presentation. On the right-hand side, you can see the specific brand names. Thank you so much for your attention, and I wish you the best of luck with getting hepatitis C virus medication approved through your insurer.